Topic 7 Mental Disorder as Disability by Aaron Jarrell Sarmiento. Social skills include verbal, nonverbal, and cognitive functions used in interpersonal interactions. Adolescents need strong social skills to make friends and gain peer acceptance. Poor social skills can lead to peer rejection and behavioral, emotional, and academic issues. ASD, called Pervasive Developmental Disorders (PDD-NOS), is often overlooked or misunderstood, especially in adolescence. PDD-NOS adolescents may struggle with psychosexual behaviors, intrapersonal and interpersonal aspects. They may also struggle with psychosexual socialization and self-esteem, and parents often notice more sexual and intimate issues in their peers. Like other ASDs, PDD-NOS can manifest differently in each person and have different developmental paths. To understand and support adolescents with PDD-NOS, a comprehensive multi-informant approach is always important and needed. This presentation will consist of case histories of different scenarios. Social skills. Social skills are discrete verbal and nonverbal behaviors, as well as other specific cognitive functions who are utilized during an interaction with another person. Good social skills are critical for peer acceptance and the ability to make and keep friends. Poor social skills can lead to peer rejection and have been associated not only with social problems but also with behavioral and emotional and even academic problems. While social skill deficits are typical of many childhood psychiatric disorders, the only two disorders which are currently defined in part by the presence of a social skills disorder are mental retardation and a pervasive developmental disorder. The term pervasive developmental disorder was chosen with the intent of signifying that individuals with this disturbance have a core deficit which involves many basic areas of psychological development. Case history. Case 1 JL. The parents described rage attacks primarily directed at his mother and making frequent sexually provocative comments to or about girls of minority ethnicity. At 14 years, 5 months, JL asked many inappropriate questions in a loud and pedantic voice. His responses to questions were vague and tangential. His difficulties in articulating ideas and tendency toward concreteness were inconsistent with his relatively adequate verbal IQ. Physical examination revealed him to be hyperreflexic and clumsy, but otherwise normal. Case 2. Her parents requested clarification of their daughter's diagnosis and help with planning for her future. Her immature and provocative behavior, they felt, could place her in a sexual danger. Behavioral problems were first reported at the age of 9 years, began to display poor impulse control and inappropriate and aggressive behavior towards peers. At the end, or at the time of the current evaluation, J.A. presented as an immature adolescent who tried very hard but unsuccessfully to communicate using teenage jargon or in a group slang. She was referred by her school for clarification of her behavior problems and assistance with management. EM's great aunt and legal guardian was requesting residential placement because her hyperactivity, impulsivity, and defiant attitude had become too much for her aunt to cope with. At the time of the evaluation, the patient was an unstigmatized girl who spoke with little effect. Her speech was inconsistent at times, it was fast and flat, and at times she mumbled. She was perservative and at times tangential. Her physical examination revealed many minor neurological abnormalities, including confusion with directionality and spatial orientation, poor fund of knowledge, inability to name parts of things, and clumsy, gross, and fine motor coordination. On standardized tests of intelligence, she scored in the range of mild mental retardation. Alright, case 4MP. He was said to have poor social skills and to be obsessed with sexual fantasies. He was said to masturbate in front of his counselor. He was also described as withdrawn, laughing inappropriately, and as having inappropriate emotional outbursts. He appeared often to have trouble focusing and concentrating on what was being asked of him, and he needed directions repeated. His eye contact was minimal, and on physical examination, he was of average size without stigmata. His examination was essentially normal. Psychological testing resulted in a diagnosis of mild mental retardation. Case 5, JF. At the time of our evaluation, JF's behavior, which had always been problematic, was further deteriorating. Although he was able to have his language needs met, he often used it inappropriately, often talking on and becoming tangential whether or not anyone was listening. JF was also exhibiting some behaviors which had both manic and obsessional and compulsive qualities to them. He was also becoming increasingly aggressive in school and at home, and past medical history is significant for a seizure disorder which began at 18 months. His thoughts were tangential and loose on physical examination, and he was a thin boy of average height. His eye contact was poor, partially as a result of his periodic gaze. His neurological examination was remarkable for a right hemiparesis and bilateral gross and fine motor clumsiness. During our evaluation, JF presented as a boy who seemed bright but talked continuously. His thoughts were tangential and loose. On physical examination, was a thin boy of average height. His eye contact was poor, partially as a result of his sporadic gaze. And his neurological examination was remarkable for a right hemiparesis and bilateral gross and fine motor clumsiness. In conclusion, this presentation thoroughly explored the experiences of adolescents who have encountered challenges in language acquisition and social engagement throughout their lifespan. Throughout their early years, they were given a preliminary diagnosis of PDD-NOS and faced ongoing challenges with an encopresis until reached adolescence. The individual has a history of facing challenges in communication, exhibiting hyperactive, oppositional, and aggressive behaviors, and struggling to establish positive relationships with peers. Thank you.